Hey everybody, it's Ryan Manno here with another installment of iHeart Wellness. Thanks to our friends at UCLA Health. I have two very special guests here today, and I don't want to get your titles wrong because, boy, these are a mouthful. Okay, so Dr. Jane Yanagawa, Associate Professor of Thoracic Surgery at the David Geffen School of Medicine.
Yes.
We're going to come back to the thoracic part in just a second, but this is
Thank
Dr.
you.
Ashley Prosper, Associate Professor, Cardiothoracic Radiologist at David Geffen School of Medicine.
That's right.
We got that solved. Okay, good. Good. Well, thank you guys both for being here. I do want to start with, I don't know why I don't know this, but maybe some of us don't. What does thoracic mean, Dr.
Yeah.
Yanagawa?
Actually, a lot of people don't know what it means. A lot of times they'll say, I'm a thoracic surgeon, and they immediately say, oh, you're a plastic surgeon, because no one even knows that thoracic is a word. It essentially just means chest, and it's the part of your body that's between your neck and your diaphragms, like above your abdomen. And the things that are included in the thoracic area are the chest wall, meaning like the bones of the chest, the ribs, also your lungs, your heart, your esophagus, your diaphragms, a lot of nerves and blood vessels, lymphatic vessels, and things like that are in the chest also.
That's a lot to pack in that little area.
Yes, so that all is encompassed in thoracic.
Yeah, okay. Dr. Prosper, let's talk about, I know we're going to kind of get into some lung cancer discussion here. Specifically, let's start with screening. Who should get screened for lung cancer?
Thanks for asking. So what we try to do with lung cancer screening is identify people who are at the highest risk for lung cancer. So it's important to understand that not all lung cancers are attributed to smoking, but when we look at things that we can change or modifiable risk factors, smoking is the leading modifiable risk factor for developing lung cancer. So what we do is we focus on people who are either currently or former smokers. And there's an age criteria.
Okay.
So you need to be at least 50 years old. You need to either be currently smoking, or if you've quit, you need to have quit within the last 15 years. And then we do some calculations to determine the quantity of cigarette consumption that you've had.
Give me an example.
Sure. So the criteria say 20 pack years.
Okay.
And what we do is we multiply the number of packs of cigarettes smoked per day times the number of years.
Okay.
So if you've smoked about a pack a day for 20 years, you would qualify.
Wow, okay. I didn't know there was like an actual criteria. So over 50, pack a day for 20 years.
Yes.
You qualify.
And sometimes it can be a little complicated to do the calculations of the amount of smoking. So we encourage you to talk to your doctor who can help you figure out the total amount.
Yeah. What happens in cases where maybe people don't know how much they smoked? Or do you find that most smokers actually do kind of have a relative idea?
I think most people have a relative idea, so we help them figure it out by asking approximately the year that they started smoking, roughly how many packs they remember purchasing, and together we come up with the best approximation.
Yeah, and I do want to mention too, you said not all lung cancers are attributed to smoking. My longtime co-host here at KOST, her mom, she battled non-smoking lung cancer for years, lost her fight a few years ago, but yeah, I mean, I remember going through that whole situation with Ellen when her mom wasn't well, and I prior to that didn't know that non-smoking lung cancer was such a thing.
It is, and it's something that we're particularly concerned about for women. So mentioning that this was a mom, that makes sense. And so what we're always trying to do is figure out who's at greatest risk so we can intervene earlier.
Okay. Dr. Yanagawa, let's talk about the importance of screening. I mean, it's probably a simple question, but why is screening so important?
The basic reason is because it's proven to save lives. So it's a life and death kind of situation. So screening is obviously important to save lives. But the other component of it is to identify lung cancers earlier, because the chances of your doing well after a treatment are a lot better if it's caught earlier, and the amount of treatment you might need would be less also if it were caught earlier.
Yeah. Are there any side effects or risks associated with screening?
So we think of a few, and the reason that we're kind of strict about who gets screened is we want to make sure that the benefit to risk ratio of screening is high, meaning you're getting more benefit than risk.
Okay.
So any medical imaging that involves radiation, we want to be judicious about who gets exposed to any medical imaging based radiation. What we do with the low-dose screening is we really minimize the amount of radiation exposure because we anticipate that if you qualify, you're going to get screened annually for several years, and we try to make sure that that's very low. We also think about the potential risks of being stressed out by the process. So we understand that just getting a scan, waiting for the results, the potential of finding something concerning can be stressful, and so that's another potential harm that we try to help people through.
Yeah.
I think it's really important to also say that I think people are so afraid of lung cancer because, you know, they associate lung cancer to meaning that there's no hope. But this is the exact opposite of that, you know, to try to catch it early, to catch it at a point where you can treat it. And we have such better treatments now, actually, for early and late cancers that shouldn't be a reason not to get it. It's because we have so much hope to be able to really treat you well if you have a lung cancer. We just need to know about it.
So obviously we you know, there are factors that go into this, obviously smoking, risk factors and things of that nature, but what specifically causes lung cancer? Like, can you explain how it forms or how it's created?
I think that would be hard to answer because there are different versions of it, and the risk factors, like we talked about a little bit, you know, they're smoking, but then how come people who have never smoked also can develop lung cancer? And we believe that inflammation can have something to do with it, and you can have inflammation for other causes too, like, for example, exposure to pollution, cooking in a small area that's not well ventilated, exposures to toxins and things like that from your environment. There's a chance that even family history could play a role too. So there's still a lot of questions, but there are things that we believe could impact, and there's so much more to find out in terms of exactly the mechanism of how a cell might start out as abnormal and then decide to become a cancer. Your immune system could ultimately play an important role in that too.
Interesting. What are some symptoms, you know, the folks maybe should think about, look out for if this is something that might be happening?
Yeah, so this is something that's starting in your lungs. So when you do develop symptoms, they're often respiratory symptoms. So things like a cough that just won't go away, or developing a lot of chest infections for unknown reasons. Sometimes it can cause people to cough up blood or to lose weight for reasons that are unintended. The important thing to know, though, is that when you screen for lung cancer, what we're trying to do is catch it earlier before you ever develop symptoms. Because once you develop symptoms, you're a little bit farther along. We don't want you to get to that point. We want to stop it before you get to that point.
Okay. And then let's talk about the treatment. Let's say you have caught it. It is there. It's happening. Talk about what our treatment options are, what our plans look like.
So definitely if you have an early lung cancer, surgery could play a very important role, and I would say just in the last 10 years it's kind of like a golden era in terms of all the options that you have to treat your lung cancer. Even within surgery itself, we are doing smaller and smaller incisions with what we call minimally invasive surgeries. That allows patients to recover faster and go home earlier and recover just a lot better. We also have ways to minimize how much lung tissue we have to take out, especially if we identify them earlier and earlier. We also have improvements in other treatments that are not just surgery related. Some patients aren't candidate for surgery, but we might still have a radiation option. We might have something called ablation as an option to treat lung cancers that are very early. And then in addition, from a medical oncologist standpoint, for more advanced cancers, it used to just be chemotherapy, but now we also have immunotherapies, targeted therapies, and the most exciting thing is that each individual type of treatment has made so much progress on their own that now we're at the point of being, how can we combine each of those advancements? So someone might get chemotherapy and immunotherapy first and then do surgery and go from there, and you find that each group was having better and better outcomes, that we could potentially even combine them and have even the best outcomes after that.
Yeah. Oh, that's pretty cool. So it's really kind of different for everybody. And do you make that decision with the patient? Like, here's what I think would work and here's what we'd like to do?
Absolutely. And it's not just me, but we have multidisciplinary discussions now. So we have something called a tumor board that brings together a specialized pathologist, radiologist, medical oncologists, radiation oncologists, and thoracic surgeons to all discuss. Oh, also pulmonologists have become a really important player in the management of lung cancer, that we all discuss the plan. And then I always tell the patients, like, you're ultimately the boss. Our job is to educate you and tell you all the options that you have and what we believe is the best, but we need to know what you think about it and how you feel about it and what you think, fits with your values.
Yeah, that's super cool. And like, you were just sharing about how technology has changed so much. You can now just take very little compared to what I don't know if an iron lung used to be, like how long ago that was. You see those images and stuff, but talk about the technology, where it's been, where it's going, and how much it's helped you guys do what you do.
Yeah, Dr. Yanagawa and I are lucky in that we get to collaborate a lot on different research projects to both improve the detection of lung cancer and then also optimize the outcomes for people that are diagnosed with lung cancer. One of the things that's really exciting for me as a radiologist is utilizing some of the new AI and machine learning algorithms to help us better understand individualized risk. So the criteria that we talked about for lung cancer screening, those are sort of blanket rule-based criteria. But where we're headed is using your images, you as an individual, to help figure out not just your risk today, but your long-term risk. And so as we get better at using some of these algorithms and figuring out how they work well and what makes them most effective, we'll probably be able to really tailor regimens to the individual.
That's awesome. And that's got to be so exciting for you.
Absolutely.
Oh my gosh, how cool is that? There's another thing I wanted to bring up, and I guess in terms of today, are we seeing more or less lung cancer? About the same? Are more people smoking? How does vaping play a role? That's kind of a three-tiered question, and maybe each of you can take a stab at it.
Well, I think that more lung cancers may be identified, but an important thing to keep in mind is that they're being identified now at an earlier stage.
Okay.
They used to only be identified at a later stage when, only, for example, something like chemotherapy might be an option. So even if there are still a lot of lung cancers that are being identified, if we're catching them earlier and have better treatments for them, that overall significantly the outcomes are improving. So actually survival, if you have had a lung cancer, is definitely better than it was before.
Okay, got it. And then in terms of smoking rates, is that something you guys kind of are dialed into? Like, are more people smoking or less people?
So absolutely dialed into it. Something that we look at is we're really tuned into California because we work in Los Angeles, and I know your audience is in California. So California actually has one of the lowest smoking rates in the country. But what concerns us is that amongst the smokers who are eligible for screening, only 1% are getting screened. So while we have a smaller population at risk, our at-risk population is by and large not getting all the early detection benefits that they qualify for.
That is a shocking number, truly. 1%.
1%, and that comes from an estimate from the American Lung Association.
Unbelievable. I'm looking at you. If that's you, go. What are you doing? Go get screened. Let's talk about vaping too. Is that a thing like that's affecting lungs now too? Pretty bad, or what? What do we know?
Probably. You know, with both smoking marijuana and vaping, those are things that are being investigated. I wouldn't say it's like 100% determined, but I think there's a lot of data suggesting that those can also contribute to lung cancer.
Yeah. What, on a personal level, what led you guys to passion for thoracics and lungs? And like, is there something in your family, or did you just find that fascinating when you were studying?
So, like many Americans, when you think about lung cancer being the leading cause of cancer-related death, so many of us are either personally touched by it or have a family member who has been touched by it.
Yeah.
And my dear aunt, who I love very much, was a non-smoker who did develop lung cancer. And so that did affect me at an early age, and I feel so privileged to be able to contribute to trying to improve outcomes for people.
That's awesome. What about you, Doctor?
I had a grandfather who also had a lung disease. It wasn't specifically lung cancer, but he was on oxygen and things like that.
Yeah.
So I was always very, at a young age, anti-smoking and, you know, things that would potentially, relate to patients not being able to breathe comfortably.
Yeah.
I mean, it's crazy to think about it, but that affects every single minute of your day. You know,
Yeah.
the energy that it takes if you can't breathe easily,
Yes.
that alone could make you lose weight, you know. So it's a huge important part of your daily life, your quality of life. I think all those things make it an even more meaningful field. It also has a lot of societal implications because wherever your lungs go, wherever you go is wherever your lungs go. You're
Yes.
just taking in the environment nonstop into your lungs. So, you know, environmental issues become really important. Education, social education, things like that become really important, and it's amazing to have a medical job as a radiologist, as a surgeon, but you potentially have an impact in so many different avenues that affect people's lives.
It's so true. Just listening to you talk, you think about how probably more than any other function, we take our breathing for granted. It's
Yeah.
just so automatic and normal. But like last week, I had a cold and I was stuffed up. And when you're like not breathing right, all you can think about is I can't wait till I can breathe right.
You don't get a break from it ever.
Yes.
Yeah.
Yeah. So wow, that's so important. And you guys are doing such great work, and it is such a pleasure to have you here.
Thank you
and
so
to
much.
shed your area of expertise with and it's really insightful stuff. So thank you guys.
Thank
Thank
guys
you so much for helping us get the word out.
I love it. No, let's do it. It's iHeart Wellness, our friends at UCLA Health. Thanks for watching.